Hello, my name is Shernaz Dossabhoy, and I'll be presenting on baseline chronic kidney disease stage and outcomes after fenestrated endovascular aneurysm repair. Fenestrated endovascular aneurysm repair, or FEVAR, has revolutionized the treatment of complex aortic aneurysms with minimally invasive and custom-made devices. Chronic kidney disease, or CKD, affects greater than 15% of the US population and is associated with poor outcomes after abdominal aortic aneurysm repair. Short and long-term outcomes of none to mild versus moderate to severe CKD patients undergoing FEVAR are unknown. In terms of our methodology, we conducted a retrospective review of patients undergoing standard FEVAR at Stanford University, and we stratified our cohort by the severity of CKD stage from none to mild, called CKD 1 to 2, or moderate to severe, called CKD 3 to 5. Our primary endpoint was the rate of postoperative acute kidney injury, or AKI, and that was defined by rifle criteria as a 1.5 times increase in serum creatinine level from baseline. Our secondary endpoints included 30-day perioperative complications, as well as overall survival, rates of dialysis, renal target artery patency, type 1 or 3 endoleak, and reintervention assessed using Kaplan-Meier method at 1 and 5 years. We also performed multivariable Cox proportional hazards modeling, and that was used to assess the independent effect of CKD stage 3 to 5 on all-cause mortality. In terms of our results shown here in the middle panel, in terms of our cohort characteristics, the CKD 3 to 5 patients were older with higher serum creatinine and more renal artery calcification on preoperative CT scan. In terms of their perioperative outcomes, CKD 3 to 5 patients had less complex aneurysm repairs, but higher blood loss, longer operating room times, and longer hospital length of stay. Their radiation dose, contrast use, operative technical success, in-hospital and 30-day events were similar between the two groups. In terms of long-term outcomes, renal artery patency, endoleak, reintervention, SAC regression, and follow-up imaging rates were similar between the two CKD groups. The progression of CKD stage occurred in 47 patients, or 31% of the total cohort at latest follow-up, but did not differ between the two groups. The mean follow-up was just over 34 months. On Kaplan-Meier analysis, we demonstrated that the CKD 3 to 5 group had significantly lower survival and higher new onset dialysis at 5 years as compared to the CKD 1 to 2 group. And that's shown here in these two Kaplan-Meier curves. On multivariable modeling, we found that age, as well as CKD stage 4 to 5, were each independent risk factors for mortality, with hazard ratios of 1.1 and 6.4 respectively. In conclusion, over 40% of FEVAR patients had baseline CKD stage greater than or equal to 3 with associated worse 1 and 5-year survival, but acceptable 30-day and long-term technical outcomes, likely reflecting the underlying disease course of CKD. However, careful patient selection remains critical, and for patients with CKD stage 4 to 5, which is an eGFR less than 30, a higher threshold for elective fenestrated endovascular aneurysm repair should be considered. For future directions, in order to create guidelines for aneurysm repair in patients with moderate to severe CKD, future studies aimed at validating these findings in larger cohorts will be essential. Thank you for your time.